A Texas nursing home evacuated, nearly half of its residents testing positive for the coronavirus. Around 60 people were taken out of the Lake Worth nursing home yesterday. Some 24 of them have COVID-19. NBC News correspondent Garrett Haake is outside that nursing home in Lake Worth, Texas. And Garrett, that evacuation happened yesterday. What do we know today about what the home is doing to protect its residents and its staff?
Well, Allison, what they're doing appears to be completing an evacuation and likely shutting down. Just within the last few minutes, we've seen yet another patient removed from this nursing home. It's my understanding that the Texas Department of HHS has essentially ordered this home closed entirely. You mentioned that some 25 residents here were diagnosed as COVID positive. The state is now treating every resident of this nursing home as if they were COVID positive. So they're being moved to other homes that can handle them with isolation wards and the like, or to area hospitals. Basically, everyone who was a resident here is being taken out. So too are all of their belongings, suggesting that this facility will be closed down permanently. It's been a focus of the governors for quite some time to really try to control outbreaks in nursing homes as tightly as possible, and we're seeing that put into action today.
Garrett, we have seen nursing homes across the country dealing with serious coronavirus outbreaks. Are there statewide safety guidelines or special coronavirus regulations for nursing homes in Texas?
There are, Allison, some 75 pages of guidelines released back in April to try to give all of these homes the opportunity to use best practices to keep their staff and their residents safe. But the reality is, many of these nursing homes face the same challenges that hospitals face at varying stages of the pandemic. Getting enough PPE, making sure that their staff are properly trained in how to use them, and indeed, their staff are here and healthy enough to serve the people who need to be taken care of. So you can have all the guidelines in the world, but if you aren't properly equipped and properly staffed, it doesn't do you much good.
All right, Garrett, we're going to go from some of the eldest to some of the youngest. I know you're covering school reopening as well, and school is supposed to start in Texas next month. You spoke with the Dallas school superintendent today. What's he saying about getting the kids back to school?
Yeah, Allison, it's a real challenge. This is probably the big story here on the ground in Texas. The guidelines for school reopenings just came out a couple of days ago. Today, the Dallas superintendent told me while he wants to start on time in mid-August, that is far from a sure thing. Take a listen.
Well, we were planning for this for a while, so initially I thought we would be ready, but I'm starting to have second thoughts about can we actually pull this off by August 17th. I'm hearing from our community members, our parents have pivoted. More than 50% of them are now saying they don't want to come, and we're hearing loud and clear from our employees, especially our teachers, that they have a lot of concern about how we can pull this off.
Allison, there are 153,000 students in the Dallas ISD school system, so you can just imagine that kind of uncertainty for that many students ricochets out beyond just for the students' education themselves, but for the economic impact here, for parents who have to plan whether they can go back to work or whether they have to take care of childcare. And one other thing from that interview with the superintendent, I asked him about high school football. That is king here in Texas. He told me he's not sure they're going to be able to play. He's having a hard time seeing how that's going to happen. No Friday night lights in Texas this fall would be a big deal.
Yeah, that is a huge deal in Texas. Garrett Haake, covering some of the eldest and some of the youngest in Texas today. Thank you so much.
Thank you.
Do states seeing the biggest coronavirus spikes need to shut down again? Here's what Dr. Anthony Fauci said today.
I don't think we need to go back to an extreme of shutting down. We've got to get them to do very fundamental things: closing bars, avoiding congregations of large numbers of people, getting the citizenry in those states to wear masks, maintain 6-foot distance, washing hands, the fundamentals that we've been talking about all along. That's where we got to start. If we can do that consistently, I will tell you, almost certainly, you're going to see a down curve of those infections.
Dr. Thomas Tsai, assistant professor in the Department of Health Policy and Management at the Harvard T.H. Chan School of Public Health, joins me now. Dr. Tsai, thank you for being here. What is your take on what Dr. Fauci said? What do states need to do to get these outbreaks under control?
Allison, thanks for having me on. I think Dr. Fauci is right. We need to use all the tools that we have in our toolkit. That includes testing, contact tracing, as well as universal masking and social distancing. My worry, though, is in the counties or states where the pandemic is growing out of proportion, out of control, we may need to think about reinstating a limited social distancing in order to re-flatten the curve so we can gain control of the pandemic again.
Dr. Tsai, hospitals in Arizona, Texas, and Florida are nearly full. What can those states learn from New York and New Jersey, states that already went through this?
Right. I think what they need to learn is to prepare for the worst. The experience from New York, New Jersey, Massachusetts showed that when the pandemic is at its peak, there's a huge demand for inpatient beds, ventilators, and intensive care units. Hospitals are developing what are called crisis standards of care, which are triage guidelines to ration scarce resources like ICU beds, intensive care unit beds in extraordinary settings. The goal is to try to avoid these situations if possible. Unfortunately, in several jurisdictions in some of the southern states, they're reaching a tipping point where they're on the verge of having to institute these crisis standards of care. What they need to learn is to not just have the supplies, the personal protective equipment or PPEs, but they also need to have the training available to help train their frontline healthcare workers to prepare them for the coming surge of expected hospitalizations resulting from the pandemic in some of these southern states.
Dr. Tsai, can you explain to our viewers that term you just mentioned, when hospitals are in a crisis mode, for example? What does it mean for patients when hospitals are in that mode?
It really means that there may be a situation where they have to ration care, basically depend on the resources that are available, who is most likely to benefit. This is a situation that we saw unfold in Italy during February and March. Fortunately, during the peak of the pandemic earlier on in April and May, most hospitals were able to increase their capacity by postponing elective surgery, creating a surge capacity of extra beds, extra personnel, even field hospitals to free up the resources needed to take care of these patients. So in most situations, the crisis standards of care never had to be implemented. The worry is whether the current situation in Arizona and Texas, have we learned from the experience of the past in the United States and Massachusetts and New York and New Jersey, for example, and do they have the capacity to increase the care to meet not just the COVID-19 patients, but the ongoing medical needs of the individuals without COVID-19?
The president tweeted today that the U.S. has so many cases because we're doing a lot of testing. You're part of a team of researchers at Harvard that looked at the amount of testing that states need to do to reopen safely. Are we where we need to be?
No. What's challenging is that there's no longer one single national narrative. We're seeing 50 different narratives in each individual state and thousands of narratives playing out in each individual county. In a lot of the most worrisome states and counties, we are not nearly testing enough. And the number of cases isn't just simply because we're testing more. We know this because the test positive rate is rising. So in places like Arizona, over 20% of the tests are coming back positive, and compare that to New York, for example, where only 1% of the tests are coming back positive. That gives you a sense of the both the scale of testing that's needed, how wide a net you're casting, but also gives you a sense of what the underlying community-level transmission, the burden of the pandemic is in each individual state. So more testing doesn't get you more cases. It's more spread of the virus that's driving up the increase in case counts.
Dr. Tsai, a last question for you. It's a viewer question on testing. If you have already had the coronavirus, if you have already tested positive for antibodies, is it worth getting tested again at some point later on to see if you still have them?
It's too early to know the data on how long any antibodies response from an exposure to COVID-19 is. We'll be learning more as we do more widespread what's called seroprevalence studies, getting a sense of the antibodies in the population, but also from the vaccine trials where we can actually test and try to understand the effectiveness of the immune response against repeated infection. Right now, there's no guidance that we need to go for retesting for any antibody testing, and there's a various degree of false positive rates and false negative rates from the various antibody tests out there. So right now, there's no concrete need to do so. But again, if anything we've learned from the pandemic is that the data are constantly growing, and we're all constantly learning from the pandemic.
Dr. Tsai, thank you so much for coming on News Now. It was a pleasure to have you. I hope you'll come back and join us again. Of
course, Allison, pleasure being on the show.
Just one day after the Miami mayor ordered gyms to close, he's opening them back up again. NBC News correspondent Kerry Sanders explains.
Allison, on Monday, Miami-Dade mayor reclosed gyms. Then on Tuesday, walked it back, and gyms are back open. I'm at the CrossFit here in Miami, but this has all really set up so much confusion. Not only what's open and what's closed, but where is coronavirus most likely to spread?
This morning, fitness industry leaders flexing their muscles, asking governors nationwide to allow them to reopen gyms. More than 60 of them signing an open letter, citing evidence, they say, proves gyms are not to blame for spikes in COVID cases.
I'm no doctor, I'm a studio manager, but from what I've read, the virus is not transferred through sweat.
But is it possible to work out safely in a gym? Orange Theory studio manager Chris Cromwell in Miami thinks it is.
Keeping things sanitized, keeping your distance, keeping the mask on, I think that these are like leaps and bounds ahead of like what other businesses are doing.
Here in Miami-Dade County, gyms were closed again Monday, then reopened by Tuesday, but with restrictions.
People, when they go in the gym, they must wear their mask. They must wear their mask all the time.
Not all doctors entirely convinced masks alone are foolproof.
If you can maintain probably like maybe 12 feet distance, if not more, as well as face covering, and again, constant hand sanitizing, it might be safe.
The CDC recommends gym goers follow some basic guidelines, limit activities indoors, especially group activities, use social distancing and limit physical contact, take extra precautions with shared equipment, and wear a cloth face covering. So is keeping gyms closed causing more problems? For some, the answer is clear.
Super happy because I gained like 20 pounds just sitting at home and eating stuff.
The CDC says physical activity can make you feel better, function better, and sleep better. In New York, gyms were supposed to reopen Wednesday, but Governor Cuomo deciding it's too soon.
We're ready to open, and a little disappointed because today would have been the day that we were raring to go.
Now, a group of gym owners is filing a class action lawsuit against the state.
We're talking about hundreds of millions of dollars of lost profits, lost revenue.
There is a very small study that looked at this question in South Korea, and they found that in high-intensity workouts in closed-in areas, people are more likely to spread coronavirus. If they spread people out, it's less likely. And interestingly, those doing things like Pilates and yoga, there was no spread at all. Allison?
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.